We're here at Sycamore Crossing. No, we're not. We're not here at Sycamore Crossing.
Man.
What's the matter with me? We are in our winter home.
We've been in overcoat.
That's right. I tell you what, we made a command decision last night or the night before. I can't remember when it was. Lisa said they were doing the football show here and said, the weather looks like it's going to be tough. So all I could imagine was us sitting out there on that cold, damp furniture with this fog settled in. It wouldn't have been pretty.
No, it'd been nice if we had one of those foot warmers or something.
If we had a little,
maybe some of that stuff you get on the ski lift, the spiced tea or something. But it's a little much for 8 o'clock in the morning. I think.
Well, you were here early this morning. You're bright-eyed, bushy-tailed.
Oh yeah, this interferes with my exercise. I usually exercise 80 minutes a day.
You get up at like what, 5:30 in the morning?
Yeah. So. And I have to wake my wife up before I leave, and get her some coffee and take the dogs out.
My wife's coming in this morning as well. So
listen,
anyway,
I'm not wearing any special tie today, but I did want to. I think I told you a few weeks ago.
Yes, sir.
That when I was in Russia, I met with a cosmonaut who had made an extravehicular trip.
And you went to his home, didn't you?
Well, no, we met him at his place of business, but there was another home we went to. But the point I'm making is that right this very minute, there are 2 American women making an extravehicular. Right this second. Yeah.
I think what did I read that they're replacing some batteries?
Well, I don't know. They're doing a wrench or something.
They're turning a wrench.
But the point I'm making is that I'm 79 years old.
I'm 72 almost.
But in our day, a great job for a woman was a school teacher. If she was African American, it was working in the post office. I mean, really, think about that.
Yeah.
And now my daughter, was the president of GE insurance business. So what's that, Genworth? She's 55 years old and went to Harvard. But thinking about 2 females in an extravehicular walk in space is really. That glass ceiling, I think.
There is no glass ceiling anymore now.
Well, they say there still is in terms of income, but at least for my kids, I don't see it. But I was thinking to myself, this is less than 15 years, I think, after the first female landed a fighter plane on an aircraft carrier.
Right.
It's, about 6 months after the first females were integrated into combat duties in the Navy.
We have a female former fighter pilot serving in Congress as well.
Yeah, but so I'm saying, I just think that's a really big deal, and for guys as old as me, it's culture shock. But I'm real proud of them, and I just wanted to say that's a big deal. And
it is a big deal.
It's a big deal, and you'll have my wife in here in a little while, and. Anyway, it's enough said about that. You want to talk about questions?
Curing cancer is a big deal, and we're going to get to the first question this morning.
As a matter of fact, curing cancer, that's this first question. You go ahead and read it now.
Okay. My nephew's 22 years old and in great health. An athlete, has Hogkins disease, and another boy in this high school, several years younger, has Hogkins as well. Could these be related to something at school?
Well, that question is written in a way that really opens up a whole bunch of doors. First of all, I'm going to tell you no, it's probably not. But I can tell you why you're thinking that way. And thinking that way it goes over some really, really, really great history that I think it's important for people to understand. Many malignancies, we had no idea what the causation was 20 years ago. And the more and more we learn today, the more we learn about how some of these malignancies are caused. There's an interesting malignancy called Burkitt's lymphoma. Now, you're a very bright guy. You do trivia. Dennis Burkitt was a English, and by the way, I met him, and he gave a talk at West Paces Ferry Hospital, and he came all the way from Africa to give it. It's a long story behind that.
That's been a while back then, hasn't it?
Yeah, oh yeah. But Dennis Burkitt was an English physician who went to Africa when Africa was still black Africa right after World War II. And he made 2 observations The first is so simple, and it has to do with fiber, and that was that the native population eating tubers and this natural diet, and if they were eating a gazelle or something, they had lower amounts of meat, that group of people had a very low incidence of high blood pressure, diverticulosis, colon cancer, hemorrhoids, and all of those things. And the genetically pure blacks in places like Defusky Island, South Carolina, and the communities that at that point had not yet begun to intermarry had a much higher incidence of hypertension, colon cancer, and all diverticulosis. And the Americans were having about 100 grams of stool a day, and the Africans were having 500 grams or more a day. That's over a pound of stool. And that was the way that the idea that high fiber diets move things through the colon fast enough so that it doesn't sit there and make cancer. Now, we brought that up, many times ago. Well, the second thing was that he noted that there was a malignant lymphoma that occurred at a certain altitude by the way, he did all that research about that high fiber diet thing on less than 200 pounds of postage and paper. Now, you think about these hundreds of millions of dollars we spend studying the sex habits of the newt or something. So the second study that he did, and it also cost less than 200 pounds, was there was a whole geography of a lymphoma that's exactly like Hodgkin's, which is why I bring it up, that occurred only between, let's say, 1,000 feet altitude and 2,500 feet altitude in Africa. And he says,
so
now what?
That strata was...
It's just like the tree line or something in the mountains, So here's what he did. He began to investigate what was peculiar about it, and there was one species of mosquito that lived at that altitude, and Burkitt's lymphoma was linked to a virus that mosquito could transmit, and above it, that mosquito didn't live, other mosquitoes lived, and below it, the other mosquitoes lived. So that was the first idea, and that's been, 70 years ago, that malignant lymphoma could have a causation that might be geographic and really due to something rather than just bad luck and popping up. You got it?
So this ties into the high school.
It ties into the high school. So if they'd say that high school was at altitude,
right.
You could have said it's due to that virus. Okay, here we go. Show up that first one. You can't turn on the TV today without seeing that ad right there, right? Have you been diagnosed with lymphoma? We can help. This is a lawyer ad. Got Roundup on there.
Yep.
Well, there's a similar thing about ovarian cancer and talcum powder. And in my opinion, even though the juries are giving out huge amounts of money, this is a fallacious link. We certainly know that malignancies can be stimulated by certain insecticides and other things, but the link between Roundup and Hodgkin's and non-Hodgkin's lymphoma is extremely thin. And some guy who's used Roundup 4 times in his parking lot or out in his yard over his lifetime who got Hodgkin's disease, it's very difficult to link it to Roundup, but if he jumps on the bandwagon, his family might get some money. Okay, show that next thing there. What is Hodgkin's disease, all right? Well, this is sort of a cartoon of the various lymph node-bearing areas of the body. And so commonly when you diagnose Hodgkin's disease in yourself or your nephew does, he's probably shaving and feels a lump like this, or he's bathing and he feels a lump under his arms, or he feels a lump in his groin. So where lymph nodes grow close to the surface of the skin, where you can find them having some size, then that ain't normal, and you go to your doctor and he gives you antibiotics and it doesn't go away, and then you go see the surgeon and he takes a piece of it and stick a needle of it, then both non-Hodgkin's lymphoma and Hodgkin's lymphoma present in exactly the same way. So that's
Are
sort
you
of.
going to talk about the difference between the two?
No, well, they have
in a
different.
nutshell?
They have different biological behaviors. It's like small cell and non-small cell lung cancer we've talked about before.
Non-Hodgkin's lymphoma.
That's right, because Hodgkin's lymphoma starts in a specific spot and then grows from that spot or spreads through the bloodstream to other areas like many other malignancies. And non-Hodgkin's lymphomas pop up in most lymph nodes everywhere. And the biological behavior of every other lymphoma is different than the biological behavior of Hodgkin's.
So one has a specific path that it follows
Well,
when it metastasizes?
yeah, but in lymphoma we don't call it metastasizes,
Okay.
but it's the same concept.
Okay.
But so the biological behavior of Hodgkin's disease, the histologic way it looks under the microscope, there is one specific cell called the Reed-Sternberg cell that is the fingerprint for Hodgkin's, and no other lymphoma has it.
Got it.
So that's why the Hodgkin's lymphoma is clearly separate from all of this legion of others that go all the way from acute leukemia of children to the smoldering, don't even treat it, chronic lymphocytic leukemia of adults. So
And
anyway.
it's commonly called Hodgkin's disease,
Hodgkin's disease or Hodgkin's disease,
Yeah,
right,
okay.
okay. Now show the next one here. These are causes and risk factors, but right at the top, they do say people who've been exposed to chemicals, pesticides, and solvents, infected with the Epstein-Barr virus. So that's the virus of mononucleosis. Okay. Go back to Burkitt's lymphoma.
Right.
Same type of virus. So there is some link between the infection with a virus or the exposure to pesticides that'll have a statistical link to Hodgkin's disease. But 99% of the patients we see have no exposure to anything. But that's sort of where this question gets its genesis. Now, this last one here is kind of interesting. This picture here, these are different colors, are states that have a higher incidence of Hodgkin's lymphoma than the nation as a whole. If you just say it's supposed to be 10 per 100,000 people, then out here in California where they got millions of pinko commie Democrats, there ought to be a higher number of total Hodgkin's disease, but compared to Montana, where they only got 900,000 people, it would still be 10 per 100,000, you see. Mm-hmm. Okay, well, it's a higher incidence in these states here.
The dark ones?
Yeah. Now, some people would say, is that because there's more industrial? Way back when, they would have said there's more industry in the Northeast.
Yeah, it's the Iron Belt.
Yeah, right. And up here, you've got
Belt,
Chicago. Yeah, right. But you got over here, you used to make shoes and stuff, and there were factories everywhere. This was dense population at one time.
Right.
So they would link,
especially the Northeast.
Yeah, but that doesn't, that one does. But when you start throwing in Mississippi and Louisiana, you miss. All right, so there's no real explanation for that. So you can pull that off if you don't mind. There was a high school in Georgia, and I've forgotten, Ludowici or someplace down there, where there were only 50 kids in the high school. This has been about 20 years ago.
South Georgia.
Okay. And over the course of about 5 years, like 8 kids in that school had Hodgkin's disease. I mean, the CDC and the World Health Organization, everybody studied it, and they got, a bunch of Georgia Tech engineers or something, and it's just, sometimes guys get on a roll, right? I don't know if you've ever been to a gambling casino. I haven't, but I've seen them in the movies where the guy's throwing, it's just sevens, and he's just making it, and he's
hot.
He's hot. He's got dice, and he's throwing the dice, and he can make millions before he craps out. It's statistical. It's unlikely that you'll throw 9 in a row and win, but the guy does. Well, that was the ultimate explanation for all of these kids in the high school. It is a statistical anomaly, and yes, the odds are small, but there was no other valid explanation. Well, that doesn't mean that next year they're not going to discover that there was, I'm not asbestos in the floor, but I mean, you can just think about asbestos. For years, we had these mesothelioma coming up, and nobody knew where it came from. And then all of a sudden, you say, my gosh, this is occurring in machinist mates in the Navy and occurring in people who work in the insulation business, putting John Mansville stuff up on the wall. And, once they could see the cluster of the occupations, then all of a sudden, well, what do boiler technicians in the Navy have that's in common to people who are relining brakes and filling stations and doing construction work, where airline pilots aren't getting it, and people who drive gasoline trucks and are around fumes all the time, they're not getting it, and that's kind of how they got to the linking between. Yes, it's epidemiology. What that's called epidemiology. What's common? Well, they weren't all Presbyterians, they weren't all white, they weren't all Hispanic, they were all boiler technicians, or they were all John Mansville insulation things, or they were guys who worked in filling stations and in mechanics places where they relined asbestos brakes. So, I mean, it's amazing if you go back and read about how that all happened. So, anyhow, so someday somebody may find out in that high school down there that they had some mosquito, or they had some virus, or they had some chemical in that school nobody has found yet. So I'm not diminishing the fact that there could be reasons for these clusters, but I will say to this woman whose nephew has Hodgkin's disease that this is a statistical event, and they don't worry about them having been exposed to something, and everybody else in school needs to panic, because when that starts happening and people start questioning the safety of their home and everything, it causes a lot of depression and a lot of anxiety. Now, if you live in Smyrna, Georgia, you got to worry about these chemical plants. They just
did another one.
They just did another one yesterday.
Yeah.
That was in Covington, Georgia, I think.
76 times the allowable.
Yeah, right. I mean, and that might not cause anything, but 76 times greater than
We're talking about these sterilization plants that use ethylene oxide.
Yeah, and
in their autoclaving.
It's very important.
Yeah.
But excuse me, not autoclaving. That's the non. It's the non-heat sterilization.
Right.
It's really important. You were asking me before what would happen if they cured cancer all at once. If they got rid of that stuff and you couldn't sterilize things without heat, it would absolutely change the medical supply industry. And you spent 50 years in it, not 50, I guess. But
but several.
30 years in it. Anyway,
Right.
A couple decades in the business. So anyway, we've got to solve this problem. Now, if that means putting this in a bubble or moving these plants way out to Montana or putting them on top of a mountain or something, that's okay. But that problem's got to be solved.
Yeah.
And I don't think it's unreasonable for, Smyrna, Georgia, and Covington, Georgia, to shut these guys down while they figure it out. But this lady here should not have to worry about it. That's what I'm trying to say.
I'm going to throw, you know me, I like to throw curveballs every once in a while. When we talk about all of these studies and, have you been exposed to Roundup and, have you been doing pesticides? Tell me the similarity, and you served in Vietnam. Tell me the similarity with Agent Orange.
Entirely different.
It's okay.
Agent Orange is dioxin.
Okay.
And that
it's a defoliant, right?
Yeah, but that's like the difference between a BB gun and a 50 caliber sniper rifle.
Okay.
Yeah, that's good for the people in the mountains, right? We all understand our firearms. We cling to our Bibles. We cling to our guns. We cling to our Bibles. We cling to our flags, and we cling to our guns. And everybody's got a BB gun.
No, but our generation. I personally know people that are suffering from being exposed to Agent Orange much later in life.
Yeah, let me go back and talk about Agent Orange just a minute. During the defoliant period in Vietnam, and I was there, the C-130 planes would fly over the jungle and would put out this great big old heavy fog that you look. if you think about these forest fires out west where you see these planes drop in the water,
Right.
that is exactly what it looked like.
Right.
Now, I want you to imagine that you're a 17 or an 18-year-old soldier in that jungle. Well, that stuff would come down on you like rain. Now, the first thing that they noticed was within a week or two, where it actually fell on a guy's back, they would get this huge rash called chloracne. And it'd be like being in poison ivy. It was an awful thing. Now, that was a very high exposure. Now, imagine that the thing came down last week, and now you walking into the jungle a week or two later, you don't see it anywhere. It's on the ground. It's in, but it's probably not. So that exposure, which was not acute and didn't cause your skin to rot off, that over time has caused prostate cancer and caused non-Hodgkin's lymphoma.
Well, that's
particularly
what I was
has
trying to tie
caused
it to.
bone marrow
Yeah.
diseases and
Right.
so forth. So that is a very clear-cut chemical exposure to a very toxic chemical that at the time was not recognized as causing malignancy. But it was put in there in such high amounts over such a short period of time that it created a critical mass in terms of numbers, probably 1 million people that were exposed to it, so that, where before that, the chemical was not anywhere. So how would you know that it was causing cancer? You put it on 1 million soldiers, then let them live 30 years, and that's a biological
I didn't
experiment.
mean to throw you that curveball.
No, that's the same.
But I thought it tied back a
It
little
does,
bit.
exactly. Same thing.
Yeah.
So anyway, we know for a fact that, and that was a good example. In fact, better than Roundup. If that sign had said Agent Orange on it, I'd said call them up.
Yeah,
But anyway, I'm not
call the
convinced that
lawyer.
Roundup is the one.
Yeah.
All right.
Anyway, I heard an interesting commercial yesterday, and it was from Northside Hospital Cancer Research.
Yep, that's us.
And it was very interesting because there was a doctor, and I think his name started with an A, but I can't remember exactly. But he was the spokesperson on the commercial, and he said how they have developed this legion of oncologists like yourself. And he made the specific example. He said, I can talk to someone in Blue Ridge, Georgia, in the Blue Ridge Mountains. I'm thinking, he's talking to Dr. Whaley.
That's right.
So
Yeah.
it was pretty interesting.
It is interesting. The thing about that is that I am older than these young people that are very smart. And one thing that I never want to do is feel like I'm out of date or what I'm doing is not in the
Relevant,
in the mainstream of
Yeah.
science.
Yeah.
Well, having 120 medical oncologists next week, as a matter of fact, the groups, the breast cancer group and the prostate cancer group, are all meeting to go over and we will come up with a plan that's best practices. And then when I type in a protocol to treat somebody, it's filtered through all of them that it's up to date. And then if I've got a question, which is really, everybody's heard me say this, I can go onto my email and say, I've got a problem, and I can either put it out to all the oncologists or I can send it specifically to the breast cancer ones and say, here's my problem. Within 15 minutes, I've got responses from experts in that particular thing saying, okay, what you're doing is right, or you should also consider this. So having this gigantic network like this creates a quality and a backup system so that everybody knows they're doing the right stuff.
I mean, that's a phenomenal clinical model that they've developed.
Yeah, it is.
The bone docs, the osteopaths, the
orthopedic
guys, they've been doing that as well. I
Yeah.
mean, they communicate with each other, and I might need a trauma guy because I've got a compound fracture here, and they've been doing that as well. So
Well, you got guys that do in the eyes. You got people that do corneas, and then the part between the cornea and the iris, and then the water part.
Yeah.
Anyway,
Yeah.
all right, let's get on.
Specialist.
Let's get on now and talk
All right,
about
we
the
got,
compression fracture. This is a good
let's see.
question.
My mother, who is 70, a young lady, had a compression fracture that the doctor said was from osteoporosis. And now they think she might have a bone marrow protein problem, and she needs to see an oncologist. What do you think?
I think that your mother is getting really good modern health care. Again, with some history, back in my early days in practice, before there was a PSA, before there was an autoanalyzer, before there were any of these modern laboratory tests that are done on your annual physical, one of the common things we would see in men with low back pain was metastatic prostate cancer that had never been diagnosed, that had spread to the back, okay? Now, women get osteoporosis and they get compression fractures, right? So show that first picture there. This is a cartoon of a compression fracture. And what that really means is that the vertebral body, you see this one right here,
Yep.
is sort of squeezed down in front
It's
this
just
way.
getting mushed.
Getting mushed. Well, this was a very common thing in fighter pilots in Vietnam, or any fighter pilot who ejects from a fighter, okay? When you eject from a fighter, you're sitting in a seat. When you pull down that
Handle.
that handle over you, well, I'll give it a little bit more of that. If you're doing this, then your hands are going down here and you can't get your hand up there. There's a little lever between your feet, between your knees, you can pull up. And then if the plane's going that way, you got this circular thing in front of you can grab and pull down. Either of those ignite, and then like shotgun shells are underneath the canopy and blows the canopy off.
Those lift charges get you right out
Dynamite, though, under your seat.
Yeah.
And that dynamite under your seat blows you straight up in the air. Now, why does a fighter pilot wear steel-toed shoes to fly an airplane? Well, because if he's being thrown back, his feet go out like that. It'll cut his feet off kind of when it hits the dashboard. And if he's got steel-toed shoes, at least it might not cut his feet off. Well, anyway, when that thing went off, it was not uncommon when you picked them up off the ground or picked them up out of the water. Oh, boy, my back kills me. They would have a compression fracture in the low lumbar spine just from that dynamite, because they got strong bones, right? Now, other people, like up here in the mountains, they'll go out to get the newspaper when it's icy, and they'll slip and fall
Bang,
right on their
the
fanny, and they get a compression fracture. Well, those are all traumatic, and those are normal bones. Now, show that next one, okay? You don't have to be a rocket scientist to see that these bones right here are really thin. See, that's the ribs that you see over here that are white.
So this is a lateral view?
It's a lateral view. This is a woman. You see she got wearing a necklace. Mm-hmm. Well, that compression fracture is bang like that, and this woman's standing up straight. So this is one of these women that you see in the checkout line at Ingalls who are bent like that due to compression fractures. And if you ask them, say, how tall were you when you got married when you were 30? So I was 5'7". Say, what are you now? I'm 5'2". Well, that 5 inches is gone in those bones that have collapsed like that. I was 5'11 and a quarter when I was in college. I'm 5'9 now. I've lost 2¼ inches, but I'm not compressed like that. I'm sort of compressed like this. They're just doing this. Okay, so that's the compression fracture. That's generally is due to osteoporosis. So let's go to this next one here. So what causes osteoporosis? Well, one of them is sex, right? Females are going to get it more than males, and that's because their estrogens go away and the bones get thin. But thin, blonde women get it worse than thick, non-blonde women. So aging gets it, early menopause gets it, inactivity, lack of exercise causes osteoporosis and fractures. Vitamin deficiency, calcium deficiencies.
That was a general announcement for anybody in the house, I might add.
Cigarette smoking, alcohol, and then the genetic thing I said, thin, lightly complected women get it worse than dark ones do. But that then why are they talking about this woman going to see a hematologist? Now, all right, show that pretty one there where the bone marrow thing is made. Now, that's why I saved this one for you, because this copy we got of it's not too good here. But this picture is absolutely gorgeous, don't you think?
That's pretty.
All right.
Yes, sir.
Here is what they have learned about your mother. your mother probably has a high protein on the biochemical profile they did when they were seeing if her calcium was okay, right? They were worried about her calcium. They were checking her vitamin D, and they noted that she had a high protein. So this is a hip, not a back. But all through the middle of the bone there, isn't that pretty?
Mm-hmm.
There are normal lymphocytes. We know about the lymphocytes. We just got through talking about Hogkins disease, right? That become plasma cells, and plasma cells what makes your antibodies when you get a vaccination
Shot.
or you get the flu or
Right.
you stick a splinter in your foot. Well, these cells can sort of become malignant or pre-malignant, and then they began to make abnormal proteins. Okay, so those abnormal proteins are what you see right there. You got it?
Got it.
All right, now just pull that down, and we're going to have nothing up there for a minute. So, here is what they're worried about your mother. These plasma cells in your mother's bones have a way of, from the inside out, dissolving the calcium out and making the bone thin that is totally unrelated to menopause, calcium, or vitamin D, and can be a pre-malignant, doesn't have to be malignant, or early malignant, or advanced malignancy, and that is the one we call multiple myeloma.
Okay.
Now, you remember we had a famous, the Secretary of State back under Nixon's wife had multiple myeloma, and that then it got to be a popular thing where they before they had the ribbons and everything,
exactly.
but it increased the awareness of women that there was something else that could make their bones all messed up. So multiple myeloma, put that next one up there. Your mother may have multiple myeloma, probably doesn't. But if your mother has multiple myeloma, they're going to be doing a blood test where they're going to find this protein abnormal in a high amount. They're probably going to go and do a bone marrow, and they're going to find a lot more plasma cells. And they will then tell you, okay, you can pull that thing down now. Most common thing I see here, and it's really common, is called the monoclonal gammopathy of uncertain significance. And I can remember
I didn't remember that.
I remember that right. It was MUGUS, remember?
Oh, yeah, okay.
It's been
So
maybe a year ago.
acronym.
Yeah, MUGUS is what that was. I used this analogy. If you go to a Falcon football game that's sold out, which there probably won't be many of the rest of the season, they're going to be...
He said with disdain.
Yeah, there are going to be 88,000 people in the stands, all right? The tickets are going to be expensive, so let's just say for the sake of argument, most of them are over 50. 4% to 5% of that means somewhere around 4,000 or 5,000 normal people in that place are going to have, by this new fancy technique that you'd get with your regular physicals, because now this fancy machine tests every protein in every cell.
That's part of the whole panel, huh?
Yeah, but we didn't know how to do that before.
Exactly.
So it'll say, oh, your globulin is high. Well, what the heck does that mean?
Yeah.
Not much.
Could be precancerous, though.
Yeah, but until we had this, we didn't know about it. People just wandering around feeling fine. Now you get it. They say, oh, well, let's figure that out. Well, it is one of these monoclonal plasma cell things called monoclonal gammopathy of uncertain significance. And then if you're a nervous Nelly, you say, oh, my gosh, I'll read it. Then they go home, they get on the internet.
Then they start Googling.
They go on the internet. Then they read about myeloma. My God, I need a bone marrow transplant. My average survival is going to be 5 years. I need chemotherapy. My hair is going to fall out with earth. No. Monoclonal gammopathy of uncertain significance is treated by watchful waiting, just like those early lymphomas. You don't do anything. And the majority of them, only 3% per year, convert to a real myeloma that has to be treated. Well, that means 97% don't. So why are you going to worry about the 3%? You got to worry more about driving out here on the highway than that 3%. So Mama may have a monoclonal gammopathy of uncertain significance. She may not have anything at all. But this is the time where Mama needs to go and see a hematologist and get a very thorough evaluation. They may tell her she's got the MUGUS, and they need to observe her. But one more thing they're going to do is they're going to give her a drug to strengthen her bones. Now, you remember Sally Fields?
Yep.
And I used this example just last week or week before last. Sally Fields advertises a pill to keep your bones strong. We have a shot that can be given subcutaneously or in the vein that's the same type of medication that is to make your bone stronger. And my analogy always is that in the Bible it says if you spread your seed on barren soil, it won't grow. On fertile soil, it grows and you get a good crop. And by the side of the road, it germinates, comes up, and is choked out by the weeds. So that says that there is a characteristic of soil that makes it better or worse for the growth of the seed, and that's what the bone is. So if you make the bone strong with this Sally Fields medicine, then it'll make it less able for lung cancer, breast cancer, or the plasma cell to grow, and it'll strengthen your mother's bones. So
makes total sense.
Don't panic. Take your mama to the hematologist and hope that the best comes out of it.
You got it.
Is that enough?
Yes, sir.
All right, go ahead.
All righty. Every week we sit on the edge of our chair waiting for the latest and greatest in medical information.
Well, you brought up, first of all, we came in here today, because I sent you all a copy of yesterday.
Right.
The Georgia Department of Public Health entered its vaping advice to all practitioners. That means pediatricians and psychiatrists and everybody got that thing I sent you yesterday.
If you got letters after your name, you got a copy of it.
You got a copy. And it said, have your patients stop vaping, 100% of them. That's more advice than I had given in the last week, because I said, still, if you got a really good product and you're trying to get off of cigarettes, I think the cigarettes are worse than the vaping. At least right now, they think vaping's probably worse than the cigarettes. I think, as you said, all vaping products are violating a federal rule. So there's no vape product that isn't technically illegal. Now, you go ahead.
The Secretary of Health and Human Services was on this morning, and I think his name was Azra, and he commented that, and it shocked me, and I mean, that's why it grabbed me. He said, every vaping product on the market, whether it's ethical, unethical, whether it's Juul, whatever it is, whether it's water-based, oil-based, it is illegal. And the interviewer sat up, just like I did, and said, what do you mean it's illegal? He said, because of the fact that the Obama administration saw a need to relax the regulations, they were able to let these manufacturers flood the market so as they thought was going to curb combustion nicotine.
Yeah. Air pollution.
Air pollution. Right, exactly.
Environmental.
So technically, I don't
Global
care how
warming.
good the product is, they're in violation and they have not been certified as
Safe.
For efficacy.
Yeah, it's safe. That's
Yeah.
right. Correct. Well, anyway, so I'd say right this minute, throw your vaping stuff in the sink, in the drawer until we learn more about
Well,
it.
let me tell you, it's going to be tough for some of these kids that have succumbed to. I heard a study last week that it's okay if it's a water-based product. If
Yeah,
it's
it's
an
not.
oil-based product that converts, and there's something going on with the conversion
Yeah, but
of that.
that's not true, though. The water-based product ain't good either.
Okay.
'Cause they can have metal in there.
And we learned that
yeah,
yesterday.
we learned that
in a-
yesterday.
yeah.
Well, the other thing I got to tell you, you remember, I spent a couple weeks ago, I was talking about the smartphone slouch. Remember?
Yep.
All right. Yesterday, American Academy of Orthopedics or something came out. It is a huge problem because, now, first of all, months ago, I showed that woman almost falling off the Grand Canyon who was doing a selfie, and all that stuff. So that you got the selfie danger. There is a marked increase in gastroesophageal reflux, gastric paresis,
Because of the fact
paralysis
that-
in the stomach, because the people for 3.5 hours, these are adults, not adolescents, average for adults, 3.5 hours a day on their machine. And so The first that's high is gastroesophageal reflux, followed by gastric outlet because it's mashing your stomach, but then musculoskeletal stress. Now, I want you to look at me like,
I'm sitting there.
okay, now wait a minute. Now, real carefully, if you look this way, you remember when you put a nut on the end of a string and swing it like that, you create a huge amount of force at the end of that string, depending on the length of the string, right? And you could bust a window with a thing that's this big around. So when your head goes forward 1 inch, you're putting 10 more pounds of pressure on your low neck, and when it goes through 2 inches, it's just like having a 30-pound baby on your shoulder. So it is creating neck and shoulder disabilities, musculoskeletal things, and arthritis within the neck that over the course of 30 or 40 years will be causing disc disease and causing surgery in the neck. So the smartphone slouch is not, they weren't here and they don't know that you've got somebody that's not coming, and we're having a longer segment today. So anyway, the smartphone slouch is causing serious musculoskeletal things. And what the recommendations were, if you are spending much time on a electronic device, is you should go to the gym for weightlifting and strengthening exercises, which is another reason to put the phone down and go to the gym.
Well, that's why they went to all those ergonomic stand up and use
that. Yes, we have them all over our offices.
Eye level and
that's right. We have them all over our office.
Yeah, excellent. That's a good segment.
All right, I'm not going to get into the STDs in teenagers. We'll do that next week.
All right. Did you have that on the kind of the
news thing? Yes. STDs in teenagers are rising like a rocket.
Sexually transmitted diseases.
Because so many young girls are going on birth control pills that the use of the condom for contraception isn't being used when you're supposed to be using it for STD control, and there's an epidemic of chlamydia in the high schools. Gonorrhea has gone up, and for the first time in a decade, syphilis has gone up.
Holy
and
cow.
The population is adolescents. There.
We'll cover that deeply next week.
That's enough.
That's enough. All right. Well, we had a great segment brought to you by North Georgia Cancer Research Specialists in concert and affiliation with Northside Hospital, right?
Yeah, the big
and
group.
I heard my first great commercial, and I threw that out there because I thought when they said Blue Ridge, Georgia, my God, that's the guy. I know this guy. I'm talking about him. Right. So always good to be with you.
All right. Well, that's
enjoy the weekend.
Good.
Stay warm.
All right. Now you're gonna have your female panel next.
Did you turn that? Yeah, we got a special surprise. We got a full female panel coming in this morning. Right. The glass ceiling on the All-Star panel has been broken.
Oh, I'm glad I brought that up. All right.
Good to be with you.
All right.
Josh, take us to break, buddy.